Hey, everybody. Welcome to today's live. We are in our 2 weeks to end pain in 2022. And I hope that you guys have been enjoying all the content the last 2 weeks we've been sharing in our Facebook group and on our YouTube channel and on our Facebook pages. Today, last week we actually did what are the underlying hidden causes of pain you wish your doctors knew. Today, I'm actually going to be doing a very personal conversation, and um, it's about how I came to know so much about pain, all my pain journey, and how I ended my own pain. And I can't wait to share all that with you. Here we go. Hey, everybody. I'm Maggie Yu, MD, functional and holistic medicine, and the creator of the Transform Protocol to turn around any autoimmune disease around naturally. Today, we are towards the conclusion of our 2 weeks to end pain in 2022. And just a little background is that I created the Transform Protocol out of my own mystery diagnosis, mystery pain symptoms over 32 years of my life. And so today we're really focusing on all the different, so there's so many diagnoses in autoimmunity that can cause pain, and there's so many mystery symptoms in autoimmunity that can cause pain, which is why if you're really wondering what causes pain, definitely I would go back to last week's live. If you want to know what the hidden causes of pain are, you can even type a comment in the comment section and say hidden causes of pain, and a member of our team can get the training to you that I did last week. It's a training you don't want to miss. Honestly, it was a pure give, 45, I think it was 48 minutes, where I went into all the different root causes of pain. And I went through it in depth last week. And this week, I would love for you guys right now. I'm sharing my own story about my own pain and how I conquered my own pain. I would love for you guys to comment in the comment section. If you're an alumni and you're watching, I'd love for you to talk about in the comment section what diagnosis you have. And if you've conquered pain or other symptoms, put that in the comment section just to share. I hate talking to you. I really like talking with you. So if you can light up the comment section with comments, that would be huge in helping me share a lot of content, help answer some questions and answers. That'd be really great. My love is for teaching, but it's hard to teach when I don't get a lot of feedback. So it'd be great if you guys can give me some love, show me some love, give me some feedback in the comment section. That'd be super great. Now, here's the other thing. If you have any questions about pain, feel free to put in the comment section as well. And most importantly, if you want my pain protocol, the exact supplements and how to take them that I do recommend, type in the chat right now, pain protocol, and a member of our team will get it to you in your message requests in your Facebook Messenger. Now, let's get started. So I, as you guys know, have been a practicing physician for about 26 years. Wow, is it more than that? And I started out as a family medicine physician, was in practice for almost, I think, 8-9 years before I came down with early menopause and a mounting of symptoms. But to be honest, my symptoms, a lot of it started in my early 20s. I actually had a herniated disc in my back. So I'm just one day pulling a bucket off the ground, boom, I fell on the ground. I had a herniated disc L5S1 on my left, which caused me to be numb and weak in my whole left leg. And that's that. Now in hindsight, there are connections there that I didn't know. And it's interesting when I look at my own mom's family history. My mom had a horrible back problem and suffered with chronic pain. And I didn't really, but when you think about it, why would a 23-year-old herniate her disc in her back, right? So there's some underlying links with autoimmunity that were signs even in my 20s that now I'm connecting. But even currently, people and doctors are not making that connection, that these are signs of autoimmunity. Think about this when you think about yourself and your own history. Now, so it started with low back pain, right? And that never really resolved. I continue to have low back pain. And then later on, I had kids. And right after I had my child, I delivered my child, I started to have some pain all over my body, like muscle aches. And and I started to have weight gain. I started to have, I had a stomach infection with C. diff because I got a breast infection, took an antibiotic. And as a result, developed a lot of pain. And now I know, looking at it, that would have been fibromyalgia, chronic fatigue syndrome. And now I also know that that was associated with a big hormone drop when I gave birth to my child. That was a trigger. That big hormone drop that you guys now will notice is a trigger for autoimmune disease, including many of the pain syndromes associated with autoimmunity. Fibromyalgia, just so you guys know, dismissed often by doctors. We just did a live interview with Joy earlier today, and Joy was talking about how some of her doctors started getting on antidepressants because it was in her head. And it was whether your doctor believed fibromyalgia was real or not. I'm here to tell you that fibromyalgia is hot damn real. And I most certainly absolutely believe that it's autoimmune related from my own experience and having treated hundreds and thousands of people over the course of my career. It isn't autoimmune related. So I do want to bring up a point about these mystery, quote unquote, in your head diagnoses that causes pain and why they're real and why they're autoimmunity. And there is proof of this. And let me talk about that. Example, I'm just going to show you that, how do you know fibromyalgia is not autoimmune? Well, because people say there's not a blood test for it. So because there's no blood test to diagnose you with fibromyalgia, then it's not real and into your head. Well, here's a medical fact. Did you know that we actually have testing for less than 5% of autoimmune diseases? At least, at most 5%. And I always use the thyroid as an example because so many of us have thyroid problems. But did you know that in the thyroid alone, this little gland right here, there's 6,000 targets of autoimmune attack. And out of those 6,000 different autoimmune targets, we only have blood tests for 3. So how many people have gotten those tests? If you're lucky, how many of you gotten those tests and then we're told, oh, you don't have a problem with your thyroid? It's not autoimmune. How the hell would you know it's not autoimmune when the other 5,997 targets don't even have a blood test to test for it, right? This is the case for me with many things like fibromyalgia, even ADD, PCOS. There are many different types of diagnoses where they call it idiopathic or they call it in your head. They call it, I don't know why it's happening, but we will find over the next 5, 10, 15, 20 years that these are all autoimmune related targets of autoimmune attack. Example, in fibromyalgia, if you think about it, can't it not be that certain parts of the muscle is the target of autoimmune attack? Right? Okay. So for me, now fast forward, I'm talking right now, this is, my fibromyalgia symptoms was about 21 years ago. But recently, it's not until recently that I was diagnosed with a mixed connective tissue disorder. It's not that it's worse or new. I had it all along, but it's the culmination of symptoms with the herniated disc when mixed connective tissue disorder is an autoimmune attack against connective tissue. So connective tissue could be in your tendons, in your joints, in your spine. There's connective tissue in your gut. So now that 21 years later, I look back, I'm like, why did I herniate? Not just my back. Later, I herniated 3 discs in my neck from some minor motor vehicle accidents. Okay. Why is it when I go to a chiropractor and get an adjustment, within 24 hours, my adjustments go out and I have to go back again? There's a lot of these symptoms and history with my personal history, but many of yours, that it's going to become clear that there's such a huge autoimmune link to this, right? So recently, I was talking to a physician that was helping me deal with, we'll go back to it, but I have a friend of mine who's a naturopath, who's a chiropractor, and we just had a very long conversation just looking at my history. And he's like, Maggie, sure as hell, you have mixed connective tissue disorder. And I was like, you're right. You're right, but a lot of you have this herniated disc, neck pain from a motor vehicle accident, like I did. I even had 2 neck surgeries. See this scar here? I had to have 2 neck surgeries. And even after the neck surgeries, continue to struggle with pain. Like it just never healed right. How many of you have had joint surgeries? herniated disc or sprains, muscle sprains and aches that just don't heal right. And you then continue to add more injury, more non-recovery to your body. And those are symptoms, right? And a lot of people just say, oh, it's not autoimmune related. And I'm here to tell you to shine a bright light on it. Hell yeah, it is. And in fact, I also will say, even if it's not, everything I'm going to tell you also works for it. Okay. But I'm just trying to point out and help you guys see patterns. My superpower as a teacher is from my own history and from treating thousands of people that there are patterns that we are missing. We don't train conventional doctors, and I was one of them. We don't train conventional doctors how to look for patterns of autoimmunity. We train them to be really good at taking care of someone after a car accident, really good at surgery. We're really good at trauma. We're really good at acute care, urgent care. But to really look at someone's history and say, wow, that is a pain syndrome, multiple different targets of autoimmune attack over years and decades of someone's life, that's all autoimmune related. And that's what I typically see in most of you. Yeah. And no wonder most of you don't feel listened to, right? Because after like one injury layers on top of another, one pain syndrome layers on top of another, you're just like, well, how much more can I take? And pretty soon you start to think you're cuckoo, or your doctor starts to treat you like you're cuckoo. Fibromyalgia, you must be depressed. Let's put you on an antidepressant. So that's what happened to me. I got diagnosed, I was talking about the pain I was in. And being in chronic pain after you have birth of a child, it's depressing. Okay. You can't even take care of your baby. I'm trying to go back to work. Of course, everybody's going to think you're depressed or anxious and you need to be put in an antidepressant. The funny thing is, I never really had much as far as severe depression or anxiety until I started to suffer from chronic pain. And now you know that that's good. Now we can actually trace it back. It was all related with autoimmunity. And after the birth of my child, one and then after another, those hormonal triggers turned on more and more autoimmune diagnosis and targets of autoimmune attack. This is why hormones is such a big pillar in our 5 pillars of transform. It's a major root cause. I learned it from living through that hell. So after the birth of both my children, my pain got worse. Now, not only was it in my muscles, then it got my joints. I started to develop severe carpal tunnel. I started to, I have a new puppy behind me, Golden Doodle. I started to develop chronic pain. I'm working as a doctor. I'm trying to use the mouse. Like every single tendon and joint in my hand and in my fingers ached like hell, and they didn't recover. And later on, standing, I started to develop plantar fasciitis. How many of you have pain in your feet and your heels, right? There's Maggie going cuckoo again. I must be depressed. No. Okay. I had plantar fasciitis. And then again, I had the car accidents, and then I had 2 neck surgeries as a result of it with chronic pain. And later on, recently, in the last 5-6 years, I started to develop severe TMJ. How many have TMJ? And how many of you are starting to think your TMJ, which is transmandibular joint here in your jaw, is actually related to autoimmunity? Could it be? Well, yeah, it could. Why? Because guess what? These joints have connective tissue in it. Okay? These joints have connective tissue. And if you have a target of attack that's in your connective tissue, can it attack joints in your jaw? Yeah. And then now you add on it, I had neck surgeries, and you can tell actually when I do exercises and I look up like this side of my neck is actually really ripply and rough, and this side of my neck is completely smooth, which means that the post recovery from the surgery caused a lot of fascia scarring here. And if I have that scarring because I never healed properly because of my mixed connective tissue disorder, could that pull on my jaw also? Yes, and hell yes. And part of my history is I found out, and later on, that I pushed really hard because I knew something was wrong with my thyroid because my hair was falling out. I was gaining weight. And my skin was really dry. My eyebrows were getting thin. My eyelashes, I was starting to lose my eyelashes. And I, was pushed and finally tested myself and got positive diagnosis for Hashimoto's, an autoimmune disease of my thyroid. And then I hit early menopause at the age of 36, hormonal, another hormone target of autoimmune attack. Now, in the process of all of this, I'm a family medicine physician and I'm learning like a whole lot on how to balance hormones because I had to save myself. None of my colleagues knew anything about hormone balance. Early menopause at 36, you're just getting older. Fibromyalgia, jaw pain, neck pain, you know, all these going to chiropractor, nothing works. I mean, it's all in your head. And so this has been a big struggle for me. I mean, this is getting real. I've lived with pain like that's like 8 out of 10 to 10 out of 10 for probably at least 20 to 30% of my adult life. This has a huge impact. So, how many of you has my story resonated something with you where it's like an aha moment, like, wow, that really sounded like me. And now I'm starting to see that there's actually links to autoimmunity here, right? Now, that's a little background. And that background that you heard sounds like a shit ton, but it's actually the average person we talk to has a very similar history like me. And I'm betting most of you that are watching right now, that history is resonating with you because you may not have my shit ton, but I'm sure you have your shit ton. And a lot of people think you're a zebra. And I'm here to tell you it's just a pattern of autoimmunity. So, how did I get myself out of it? So, let's share that. And if you're an alumni, you're watching, please share your story in the comment section of how you overcame your pain in the comment section or any other symptoms of autoimmunity. If you're watching this is resonating with you, tell me one aha, one connection you're making in the comment section. Remember, I don't like to talk at you, I want to talk with you. Okay. So, let me take a quick look at some of the comments right now. I see Tracy here is saying that she has PCOS. PCOS, I'm going to tell you later on, is we're going to find that it's linked with autoimmunity. PCOS is a precursor for diabetes, and it's a major hormonal disruption. And diabetes is an autoimmune disease. So, what the hell is PCOS? An autoimmune issue. Okay, so this is why hormones is a big pillar. And look at her multinodular thyroid with goiter, right? I'm going to tell you that this is another pattern we're missing, and we have tons of trainings around hormones. But if someone has PCOS, or well, listen to this: if someone has multinodular thyroid with goiter, 100% that's already autoimmune attack against your thyroid. But if your body's attacking your thyroid and seeing those hormone making cells as a germ, what's the likelihood it's going to see your ovary hormone making cells as a germ? 100%. This is why everybody who has any autoimmune disease of the thyroid is going to have a shit ton of problems with their ovaries, with their adrenal hormones, with their insulin hormones, with their brain hormones. This is a pattern that's missing, but I digress. So, but Tracy, thank you for sharing with that. But Tracy is also sharing here. She's been diagnosed with fibro, TMJ. Wow. Okay, girlfriend, we're twinsies here. So she's got fibro, she's got TMJ, she's got the chronic paroxysmal hemicrania, she got POTS. POTS, it's a blood pressure thing that we treat in cardiology as a cardiac problem. It's an autoimmune issue. Okay. MCAS, mixed connective. Raynaud's, which is autoimmune of the blood vessels, right? That's mixed connective tissue right here. Your arteries are made with connective tissue. So you already see a link. I already see in Tracy's list of symptoms right here, a huge link with a mixed connective tissue disorder, with her muscles under attack with fibro, her TMJ with her joints in her joint, Raynaud's with the connective tissue around her blood vessels. She's got herniated discs, just like me. Discs are made of connective tissue. And arthritis galore, joints, right? Pain off the charts. This is a pattern that her doctors are missing. I even miss as a physician myself. And not until I lived this hell that I learned that what I had to do to get out of this hell. Because what is a typical solution for Tracy here? What is a typical solution for a Tracy or a Dr. Maggie who has these symptoms? Offers of pain medication, right? Yeah, no thanks, right? But if they offer you pain medication, you have to. You can be addicted to it. Joy this afternoon when we had interview with her, she was just given Vicodin for her fibromyalgia and antidepressants, and she had to wean herself off the Vicodin. Right? What the hell are we doing? Just throwing pain meds at these underlying autoimmune disorders, right? So if you think about it, fibromyalgia, TMJ, what are we talking about? We're talking about all these diagnoses is going to be pain meds. Oh, and I'm sure she's depressed after all of this, right? And she can answer in here. You need an antidepressant, little lady. You need some therapy. And then you look at, her herniated disc. Oh, you need surgery now. Let's do a surgery on your back. Let's do multiple surgeries on your neck. 2 surgeries here. So we're kind of just sitting ducks for these band-aids of surgery, pain medication, antidepressants, none of which address the root causes. Okay. So thank you for sharing that, Tracy. That's really awesome. And we got Lisa here who says she's been diagnosed with MTHFR, and that makes a difference. Yeah, there's a lot of genetic metabolism disorders that are linked with autoimmunity that makes your symptoms worse, which is why in our program, we have to test for certain vitamin deficiencies, and I have to teach you the why around this. There are genetic and biochemical reactions that are different in people with autoimmunity. We are more prone to some of these genetic deficiencies that make it harder for us to break down inflammation. Okay. Believe it or not, someone with an MTHFR deficiency, which is really common in autoimmunity, I'm missing most of the genes that you can test. I'm missing all 4. I'm what I call recessive on all 4 of those genes. So that's really common. And what I see in autoimmunity is that we can't methylate, which is the problem with MTHFR. And when you can't methylate, you can't bring down an inflammatory substance in your blood called homocysteine. Okay. High inflammatory load. That's why we don't heal. So there are components of genetics here that you guys don't understand that I had to put together myself that fits an entire puzzle, which is why they are different pillars of Transform. So thank you for sharing that, Lisa Howard. That's really awesome. I like this one. Tina says, but my labs are normal. Bullshit. Okay. They don't even know what the right labs to order are. And the other thing I already mentioned, there are no labs for the autoimmune targets for most autoimmune diseases. So what? You're negative for autoimmune disease of the thyroid because 3 out of the 6,000 targets are negative? Right. Take that to the bank. That is, how can you tell someone they don't actually have autoimmune disease of the thyroid when you can only test for 3 out of 6,000 targets, right? So this whole thing, my labs are normal. How many, I mean, I can't even tell you how many people get on the phone with our team and they said, I'm so sick and tired of being told that begging for these lab tests, many of which aren't even the right lab tests, and then being told my labs are normal and I'm fine. How many of you fit in that boat? Okay. So, yeah, Tina says exactly. So I totally got you 100%. I'm with you. So let's share my part of how I got out of it. So this is why the 5 pillars of Transform was actually made, saving my own life, saving my adult life from living in chronic pain and depression, to be honest, from all that pain. So number 1 was I realized food really mattered. Okay. Food really matters. And I'm so tired of people begging their doctors for allergy testing, or they think they can go get a food sensitivity testing. Or I'm also tired of them going to the allergist and saying food testing is bunk, poo-poo you, food doesn't matter. You have ulcerative colitis and Crohn's, go eat some bread and bananas to calm your gut down. I mean, I don't even want to go off on the whole food mapping tangent, but I can tell you right now was that I had to discover how bad food sensitivity testing was myself to realize that there is a lot of bad tests out there. But that doesn't mean food doesn't matter. Food freaking matters. So I had to really go out. I tested thousands of tests. I probably have spent $100,000 just on different types of tests, testing on patients, myself, over the course of the last 20 years to come up with, is there good tests to find out which foods actually trigger autoimmunity? Yes, there is. Okay. Yes, there is. That's what we use in our program. But that's not even the beginning or the end of this thing. I realize even using the right tests is that doctors out there and even the company themselves don't even understand how people with autoimmunity have what we call false positives, false negatives, which means that I had to figure out, I do thousands of these tests on people, even the best tests. And I'm seeing a pattern in autoimmune people is that they frequently have false positive on this. And that means it's not even positive, but it's a fake positive. Why is there a fake positive? And I figured out the why. When you do the right test and you figure out why that's a false positive, then you know what's a real positive. Then you have real actionable data, right? So for me, it took a while for me to do that. I mean, I've invested over $1 million over the course of the last 20 years of pain and suffering in my own education on how to get out of this. And a lot of it was spent on testing, and seeing results, right? So I figured out that gluten was terrible for me. Terrible. And I can tell you right now that when and it took me a while, even after I went gluten free, to really figure this out. And the thing is, it's not just gluten. There were a couple other things. And so that makes it a really tricky picture, because a lot of people be like, I went gluten free and nothing happened. Well, what if it was gluten, broccoli, and sesame? It's healthy, but you could still feel shitty if you're eating the broccoli and sesame. This is why food mapping was created. So without any doubt, we have a process called food mapping where we do blood work, and I teach you what are false positive negatives. We teach you how to remove the foods, but there are certain foods that you need to reintroduce to test whether they really are positive or not. So it's a whole process here, and that's why it's a really important key of the program. I went gluten free, and now I'm going to tell you, when I do eat gluten again, immediately my legs go numb and weak, and I'm in severe back pain, and I'm in severe jaw pain. This is how I know it's autoimmune. It's not by accident. Those things hurt and don't heal, because you know what? Gluten is one of the biggest triggers of autoimmunity. And I know for me as well, even based on lab data. So the moment I eat some gluten, boom, it's like my pain comes right back. So I don't have to do that anymore. And it's no pain in the ass to go gluten free. If I know I'm trying to prevent myself from having 10 out of 10 pain, you betcha I'm going to do it. How valuable is that data? Priceless. Because I don't want to spend the remainder of my life in 10 out of 10 pain. So number one, food matters, and food mapping is absolutely key. I have tons of alumni, if you're watching, and food really made a difference, type in chat. But if you're interested in learning more about food mapping, type information on food mapping. I'll get it to you, because you know what? We literally have hundreds of testimonials of people who've gone through the food mapping process with us, where we exactly identified the foods that's triggering their pain or any of their autoimmune symptoms. So number one, food absolutely matters. Number two was my digestion. Digestion really matters. It's not just the food that you eat, it's what happens with the food once you consume it. This is why gut healing is another pillar here. No functional medicine physician program, no regular conventional medicine doctor ever even discusses the role of digestion. Here's what I learned was that my digestion, here's what I learned. My digestion really wasn't happening. I didn't feel necessarily a lot of gut symptoms, but I realized was that as I was just eating over, I had constipation that I was dealing with. But I also was gaining weight, trouble losing weight. A lot of my vitamin deficiencies, like B12 and iron, just weren't improving, no matter how many expensive supplements I took. And it finally dawned on me that there's an absorption problem here. There really is an absorption problem. And I started seeing patterns with all my patients was that they were really deficient in like calcium, magnesium, B12, ferritin, vitamin D. A lot of these deficiencies really contributed to chronic pain. Having low magnesium is going to cause your muscles not to be able to relax. Magnesium is also really important in enzyme activities to actually like help your muscles make energy and also heal once you exercise it. Muscle recovery requires magnesium, right? So I'm loving this. We have alumni here. Jen, who's saying data is king. I love it. Diane, another alumni with RA. Food made a major difference. No more inflammation. Amy here wants info on food mapping. Who else wants information on food mapping? Type it in the chat right now. Yeah. So I'm going to tell you that I learned that digestion was a big problem for me. And I did a ton of research, took a bunch of seminars, functional medicine seminars, really also looked at products. And I experimented with a ton of different products. And I realized that I really needed multiphasic digestive support. And then now the data is flooding. There's data flooding in the autoimmune world that, in fact, did you know that 90% of people with autoimmune disease don't make enough stomach acid? The first step of digestion in your gut. So if 90% of us with autoimmune disease have low stomach acid, that's just one step in digestion. How many percentage of us have other steps that add on to this problem? 100%. All of you have digestive problems. Here's the problem. I realized that digestive enzymes really decrease inflammation so that it makes less pain. So think about it. If let's say I have a problem with gluten, I have a problem with broccoli, I have a problem with sesame, right? and I'm not digesting food well. So what happens is these allergens present themselves into your gut. You don't break it down. These whole allergens actually present in much higher amounts into your bloodstream. When these allergens that you have a problem with your autoimmunity present in the bloodstream, it causes the attack of the autoimmunity to be tenfold, 100-fold to every target of an autoimmune attack, not just your gut. So it was attacking my thyroid like crazy. It was attacking my mixed connective tissue disorder like crazy. It was attacking, my hormone making organs like crazy. This is why I went into early menopause, because I kept eating food, not digesting it. Those are foods that trigger autoimmune attack. I wasn't breaking down the allergens. Those allergens presented right into my blood, and I was like a petri dish of autoimmune attack, feeding it. Okay. So sure as hell, digestion matters. Who wants the pain protocol that I came up with? Because write pain protocol in chat. Because what I found out was digested is a digestive enzyme in our pain protocol. And it took me a decade to come up with that product. And here's why is that, I knew digestion mattered. I went through this journey. Now literature is coming in. But still, one of the things I know is that people with autoimmune disease need tons of digestive support, right? But we're also allergic to a whole ton of a lot of stuff. We also have a ton of absorption problems. We have trouble tolerating a lot of supplements. So it took me many renditions to figure out what is the best multiphasic digestive product that actually also had the minimal number of ingredients that worked. And that's where Digested came in, which is why Digested is actually currently right now the number one selling product out of the store right now, because we are 100% of us don't have digestive enzymes or have some part of our digestion that's broken. 100% of us, 90% of us don't have stomach acid. 100% of us have some other combination of digestive problems. So do all of us need digestive enzymes, and does it help with the pain? The answer is 100% yes. So it's not just what you eat, it's what you do in the gut with that food to decrease the allergen presentation and inflammation. This is why Digested is the number one product selling in the store. It's in the pain protocol. If you want the pain protocol, type that in chat and we'll get it to you, and we'll have instructions on how to use Digested. How I use Digested is I take one with small meals, two with big meals. If I do that every single day, guess what? My pains decrease 50% automatically. If I don't use it automatically, my pain is way worse. So this is a really important piece to understand, is that digestion really matters. Okay. I'm seeing people asking for pain protocol in here. Diane, one of our alumni, says, daughter and I don't go without it. Digested works wonders to get our system regular. Thank you for the feedback. I love real people and real results. Thank you so much. Lisa says, I have GERD and I take Prilosec for over 20 years. You already have low stomach acid. So they give you a drug to shut off stomach acid, exacerbating all the autoimmune issues. So sad, right? So this is, it's one of those really big misunderstandings that people have, that doctors are trained that heartburn is from high stomach acid. It's the opposite problem. So yeah, so I'm just going to tell you that even if you're taking a Prilosec, any of these medications for stomach acid, you still have low stomach acid. They just misunderstood your problem. And Digested is really great for people to take to get started. And it's actually can help address the underlying digestive problem, which can actually help you wean off some of those medications. Doctors prescribed it for the last 20 years and said, never mind, shut off your stomach acid. And over 20 years, now we find out that it's a major cause of it can cause osteoporosis. It can cause increased certain cancer risks. It's associated with tons of long-term chronic diseases, because you can't we already have low stomach acid. You shut off your stomach acid for 10, 20 years. Stomach acid is there to digest your food, break down allergens, kill germs. Why do you think you're so prone to infections? It's because you have no stomach acid. And then your doctor puts you on Prilosec to shut down more stomach acid. So how important is digestive support? I found it was huge. And that was a major game changer for me when I really discovered digestion was king in dealing with my pain. And then we talked about, oh gosh, awesome. I got Amanda here who said Digested, bioavailability. Yeah, because what happens is when you have a product to really digest your food, all those expensive supplements that you're taking actually can absorb and actually be bioavailable in your bloodstream. So it makes no sense to me to not recognize the digestive problems that people have with autoimmunity and then tell people just buy and buy and buy all your supplements. right? So I have to educate people about digestion. Finally, don't forget that, when you address the root causes of autoimmunity and turn down the autoimmune attack, every target of autoimmune attack can come down. I don't have to chase my jaw, my neck, my back, my neuropathy in my hands, or my fibromyalgia. I'm not playing whack-a-mole seeing 20 specialists. I did everything in this program and created this program and really pulled the autoimmune attack down so that every target of autoimmune attack, all the pain areas, including all my hormonal areas, is in remission because I stopped feeding it. That's where the transform protocol is king, because there's a hormonal component here. I went to early menopause. How many of you going through monthly cycles where your pain is worse, right? How many of you are going through menopause, perimenopause, and your autoimmunity is going crazy, right? Your pain's going shit and crazy. Or how many of you around, 35 and 55, right in that range, men or women, and suddenly your pain is through the roof, right? So that was me. So these are covered in the 5 pillars of transform, and I haven't even gone into, finally, the other thing is blood sugar. That's another pillar of transform. I've realized that when I hit low blood sugar was when my pain was worse. So guess what? My late afternoon, I would not eat breakfast, right? Because you know what? I was nauseated. Guess what? I was nauseated because I had low blood sugar, and then I don't eat, right? This is a big problem for most of us. Which is why blood sugar mastery is a big pillar. But every time I hit low blood sugar, my pain was shitty. How many of you get headaches or migraines and are now realizing they happen certain times of the day, either in the morning or in the afternoon, right? So it's really important to look at the role of blood sugar, which is why we have a whole line of blood sugar support supplements. But supplements is there, but nothing beats fixing blood sugar problems with education, functional nutritionist support, and training that we do in the program. So I would love if alumni here have noticed that blood sugar was the huge linchpin for them in ending their pain. What I had learned was that when I actually ate a balanced fat, protein, and fiber, breakfast, lunch, dinner, and snack, and definitely a snack before bed, not only did I lose weight, wasn't craving sugar like crazy, but my pain stabilized. And are there supplementations or medical food that makes it easier? Yes. This is where my collagen came in. In the morning, I couldn't eat. So I would just do warm water or tea or coffee with a scoop of collagen right in it. If I want some fat in it, throw my Pro MCT in it, drank it, no pain. Missed it, late morning, pain. This is personal experience. And it's not just me. I mean, there are thousands of people that I've worked with where this is absolutely the case, So for me, there are supplements, for example, Golden Balance, that I do as a medical food right before bed. If you guys want to see a video training I did about Golden Balance, type Golden Balance information in chat. I use Golden Balance every night to actually balance my blood sugar. Relaxer is also another product that we use for people with PCOS, diabetics, or people who have a lot of blood sugar problems. Relaxer, I would even do alone. I would add it to Golden Balance. 1 scoop of that at night, the myo-inositol in there is super awesome for balancing blood sugar through the night. Because how many of you wake up in the middle of the night because of how much pain you're in? Or how many of you, when you wake up, the first thing in the morning is the most pain you're in? Well, it's because your blood sugar was tanking all freaking night. I learned that through personal experience. And this is why I teach it. And if mastering blood sugar just meant cutting out sugar, you don't need me. I didn't need me. But it's a whole hell of a lot more than that. So, which is why there's a whole program around this. There's a whole pillar of blood sugar mastery in our program. So Golden Balance is a great supplement, and relaxers, and you can also add to it. That's really great at night to take to really help with your body to heal, but also to prevent that pain in the middle of the night or in the morning. So that's another way that I had to, blood sugar really matters. So I didn't even go into physical modalities here. Now, are there physical modalities that I use that really helped with my pain? And the answer is yes, yes, and hell yes. Okay. So one method that I learned, like I would go to a physical therapist, didn't really help, right? Because it's not something I could do continuously at home, modify it. And even when I went to physical therapy, it wasn't like I got immediate relief. And there's just so many things that hurt. So what is a self-maintenance program that I really did that really helped my pain was Melt Method. I can't thank Sue Hinsman, creator of Melt enough, or Amanda, who is a alumni in our program. She went through this program several years ago and introduced me to Melt because she's a Melt instructor. I bought the rollers from Melt. Watched Sue's neck release, and you know how much neck pain I had. The first session of Melt with on a YouTube video doing the neck release, my pain and my range of motion was reduced by 50% immediately. So that's why Melt Method is part of our Transform program. And I have nothing but respect for Sue, Amanda, and all the Melt instructors out there. And now it's like really, it's catching like fire because my physical therapists have heard about it. My chiropractors have heard about it. I mean, this was not mainstream, years ago, but now it's like really catching some momentum. I do Melt every single day. So I do self-care through Melt. It's also part of our program is that we require everybody in our program to learn how to do Melt and to do Melt. Like I tell people to do the hand and foot sequence in the morning and the rebalance sequence at night because that shit works. So yeah, and yes, and Diane says still melting, right? Remember, this is in the annuals of Dr. Maggie only recommends shit that works. So I only do shit that works. I'm not going to spend time doing something every day if it doesn't work. So physical modalities was really great. Was I use Melt Method. And for those of you in the Facebook group, Amanda does offer, she does a live Melt class for people in our program and for people in the Facebook group. So that announcement comes up in the Facebook group. If you're interested, make sure you click the link because she does make that every Saturday. She does an announcement. She does a live class with Melt. And I make as many of those classes as I can as well. The other physical modalities I use is I absolutely believe in finding a really good chiropractor. So many of us with autoimmune disease have mixed connective issues we don't even know about because you know what? We don't have all the blood tests for mixed connective tissue disorder. So if parts of my story about, all these pain that never healed right, I can't underscore the importance of finding a really good chiropractor. And in my case, I found a chiropractor, Dr. Nicholas McBride here in Portland, and Dr. Tony Ilo here in Portland, Oregon. And they specialize in a method of chiropractics called NUCA. And NUCA are chiropractors who are specifically trained to adjust upper cervical, the upper neck, with specific levels. And they really use data like x-ray measurements and everything to be very specific and precise with their adjustments. Most of us here can't just go to a chiropractor just and call it good because we have some very specific misalignments because of the autoimmunity. And so I don't like general just crack and leave kind of thing. I think it's important to actually work with a very educated chiropractor, someone who has NUCA training. I believe it's spelled NUCCA, and I believe you can go on a website to Google to find a NUCA chiropractor near you. But that's been huge for me to have a good chiropractor as part of my team, right? And the third modality that I use is going to be acupuncture. Acupuncture has been an incredible part of my recovery. Specifically, the acupuncturist that I work with, her name is Hasina, and shout out to Hasina Cohen at Dragon Rises here in Portland, Oregon. But she and the clinic specializes in a technique of acupuncture called Shen Hammer Pulse Diagnosis. And this particular form of acupuncture is definitely much more root cause, time consuming, and holistic. So you can't go to an acupuncturist sometimes and just mow and blow it. But there are a lot of acupuncturists who are actually trained to really look at the whole body holistically. They're not working 4 or 5 rooms at once. They're spending like when I'm there in an appointment with Hasina, it's an hour. And she's spending the whole hour with me, and it's not just mow and blow. We can mow and blow with acupuncture as well. So there's a holistic way of acupuncture that many acupuncturists are really great at, and it's really great for you. They don't have to be Shenhammer trained, but I think it is important to find an acupuncturist that will spend time with you. They may cost more, and they do, but you know what? Their time is valuable. Their training is valuable. So I value their insight, and I value the fact that if I have to pay more to see a chiropractor who's going to be holistic and knows me, or an acupuncturist, even if they're not off my insurance, I make the resources to make it happen because it works. Because it works. You know what's expensive? spending money on shit that doesn't work. So a lot of people will be like, oh, that acupuncturist is not covered by my insurance, but I'm going to pay a $30 copay to go see this other acupuncturist, even though it doesn't work as well. But to me, if you spend $30 on something that doesn't work, that's a waste of money. If you're going to spend $100 but on something that works, that's actually a cheap deal. To me, whether something's a good investment and worth spending is really based on the results you're going to get. So that's why for me, it's really important to realize is that you're going to spend money on health. Okay. And I think philosophically, you could spend money on the front end of eating good food, healthy lifestyle, and working with providers who's going to be helpful with prevention of further progression, right? You can pay it up front, or you're going to pay the same thing back end, which is you pay for sickness. You're going to pay 20 grand going to the hospital in the ICU stay for a month. Worth it? Or you could have spent that at the front end, never had that happen. You're going to spend it anyway. So which end are you going to spend it in? Front end in prevention and investing in your own health, your own education, and your own results, and to prevent even a diagnosis later. That's worth its weight in gold. So I think it's really worthwhile to find some really good providers, like a good chiropractor, good acupuncturist on your team. Learn a self-care method like MELT that I do every single day. That's what it takes to actually get my pain to a really low level on a regular basis. There are parts of me that are permanently damaged that are going to hurt because I had 2 neck surgeries, people. I have a herniated disc that's not going to be unherniated. But can I prevent further progression? Can I prevent them from hurting? The answer is yes, yes, and hell yes. And that's what got me out of pain. And that's how in the Transform program, we're able to help people with any diagnosis or no diagnosis to get their pain under control. I hope this was really helpful because I mean, we're almost at an hour, and I hope you guys understand that I really wanted to go in depth to give you a holistic idea of what it took to build Transform as a protocol, as a program, and to deliver that. But it really was out of my own pain, personal experience, and investment in my own education and in my own health to be able to teach this and share this in a way that's understandable for you and learnable for you and for those in our program. So let me take a quick look. Amanda says, love prevention. And Tina says, that's true. Thank you. Let's see, Amanda. Yep, Amanda is the one who teaches MELT. She's an alumni in our program. MELT supports connective tissue and nervous system to decrease chronic pain. Hell yes. And I swear by it. I swear by it. Okay. Tina says that she has terrible neck pain due to nodules. Nodules only occur as a result of autoimmunity. I wish doctors would understand this. This is why public don't know this. Autoimmune people. And then let's see. I mean, here's an interesting question. Lisa says, how do I find out if I have an autoimmune disease? Why does it even matter? Like, why don't you just want to end it? Everything that I said here applies to everybody with autoimmune disease or not autoimmune disease. Food matters. Digestion matters. Blood sugar matters. Hormone matters. Your vitamins and minerals matter. Physical modalities matter. It doesn't matter what your diagnosis is or even if you have autoimmune disease. If you're on a search for autoimmune disease, you want to go see a bunch of conventional doctors to find diagnostic testing, go for it. That's not why I'm here. I'm here to tell you how to end it. So you can absolutely, Lisa, if you're interested in learning whether you have autoimmune disease or not, that's the trail you want to go on. You can definitely go look at a conventional doctor and ask for some autoimmune testing. And I get that. I mean, people are on that train for a long time. And someone else has said true, Tina. All right. I hope you guys enjoyed that. This ends our week for 2 weeks to end pain in 2022. It also is a share of how I overcame my own pain. If you're interested in working with me and learning more about Transform Autoimmune and learning more about our program, there's a link above to chat our team, and we have a chat below here that you can chat our team. Get a chat started so we can learn more, because it doesn't matter what your diagnosis is. Trust me, this process is going to work for anybody. We just had an interview with Joy today with fibromyalgia, and her biggest question before she joined was, well, would it work for me? First, she thought, oh, these interviews were fake. Then she realized after a couple hundred, well, they're not fake, they're actual real people. Then she said, well, it worked for me. And she had a really big message for everybody. She says it absolutely worked for her. And she's seen it while she was in the program work for everybody else, no matter what their diagnosis was as well. So yes, this really works. So again, I hope this was helpful. And this wraps it up, our week to end pain. I hope that you got a lot of value out of that. And happy 2022. We're still in January, so happy New Year, everybody.